Talks, and my guest today is extra special. Why? Because he's a doctor, he's a senator, but most of all, he's my friend. Welcome, Dr. Mohmand.
Thank you very much.
So, what should we talk about today? As we were talking earlier, mashallah, you have such a lot of experience in so many things, and basically loads of experience in life. And you have a wonderful way of expressing yourself. I'm feeling very greedy. I want to talk about everything.
Well, at my age, you see, when you turn 60, you have a lot of experience by that time. As they say, satya gaya hai. So, main satya gaya hu. I've turned 60, so that's satya gaya, na?
Satya to hum sare hi gaye hain. So, let me ask you about something that has always inspired me about you. Let's talk about that. When I first met you, long time back, उस वक्त से अब तक, the things I've seen about you that really truly inspired me. A is your focus, your clarity about where you are and where you're going. B, you're a friend who's really there for all his friends. And 3, your employees. They love you, they adore you, they never leave you. Right? So which part of it is really something that you're really proud of? Which part of the success?
Well, you see, it's difficult to say which part. I mean, all these aspects of mine, knowingly or unknowingly, makes me who I am now. Focused, I've always been, I always believe in something. Success is 50% planning. So half planning is success. If you plan something and then execute it, you are already a winner by 50%. The rest of the 50% is only a matter of time. So right from the beginning, I had something in mind. As a professional doctor, all my colleagues were going towards becoming an assistant professor. I also applied for that thing. But then I believed in something. I believed as a professional, I should not go towards this grade 17, grade 18, grade 19, grade 20, because that's what rat race is. And as a professional, I always considered myself as a horse. So why to run a rat race when you are a horse? So I went for a horse race. Now, horse race in the wild can be dangerous, but at the same time, it could be rewarding. So that's my concept of going towards that. The other concept was that in a stage of a person, he works for someone, then he works for himself, then people work for him. So when I started my career in Pakistan back in 2000 or 2001, I started more or less 3 of them simultaneously. So for a hair transplant, I was working for someone. For cosmetic surgery, I was working for myself. So I would there was nobody employed by me. And number 3, the lasers, I had a doctor working for me. Mm-hmm. So in that way, gradually over the period of time, I shift the gears, stopped working for someone. And since then until to date, I am trying to expand on those 2 things. So now hair transplant, people work for me. In cosmetic surgery, people work for me, and I do myself as well. And in lasers and everything, only people work for me. So it's everybody's time, and then I do it. Second aspect is, so that is how I will see that you need to plan what you want to do in life. Mm-hmm. So you need to have a clear concept of that. Second thing is, I'm a professional doctor, or my staff loves me, they are still with me. Somehow, yes. I don't know if it's my weakness or it's something I believe I'm responsible for them. For the simple reason, as they say, kullukum ra'in wa kullukum mas'ulan an ra'iyatihi. And everybody of you would be answerable for the people you are responsible for.
Absolutely.
So I try to make sure that in my profit, everybody takes a share. So that's why most of my staff is with me for the last, 25 years, 19 years.
As I've known you, they've been there, the same people.
So whoever joined me has not left unless they left themselves or some major problem came in. Yeah, well, these things do happen.
They do happen, but Dr. Hamayun, एक चीज जो आप planning का कह रहे थे ना, मुझे याद है a long time ago you mentioned that every night before sleeping, you evaluate your day. What
Yeah,
you did
yeah.
right,
Yeah.
what you did wrong.
Yeah.
That's something that उस वक्त से मेरे जहन में I've never been able to do it. I would have maybe done much better in life had I followed that example, but that stuck with me. This evaluation of yourself every day and then trying to do better the next day.
Well, I always put it like this. अक्सर शब तन्हाई में कुछ देर नींद से पहले. You know, when you close your eyes and for the world you have gone to sleep. Your family members see your eyes are closed and they think he has gone to sleep while you're still awake. That is the time you reflect on yourself. That is the time when you see what happened, how it happened. You know, it could be a surgery, it could be anything, and it could be the next day surgery, and you're planning, okay, fine, I'm going to do like this or whatever. Or it could be a fight between friends, or it could be something. And I would evaluate how it is. That was also one of those nights. I clearly remember something around 2003 and 4, not 4, sorry, 2005 and 6, when I was, whinging all the time, complaining what politicians are doing, what people are doing to Pakistan and blah, blah, blah. And then I asked my question, okay, fine, Humayun, what have you done for Pakistan? So the answer was nothing. So that is the day when I changed my distribution of time in such a way that from that day till 2008, I started to give 1 day to the politics, 1 hour on a Friday.
On a Friday?
On a Friday,
1
after
hour.
Jummah, for politics.
How?
It's just in 2007, there was this, lawyer movement. So I was there and some PTI, I didn't know them. So I was standing there and these PTI guys came and said to me, what are you doing? And blah, 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 blah. So I said, I'm so and so. So, and I, complained about politics and everything. They said, okay, fine. You don't have a concept. Why don't you come and join us? Just sit with us for an hour and see what we do. You like it, you join. You don't like it, you don't join. So I said, okay, fine. So I went there, started to give my time and every hour, and I started to realize that these people are genuinely concerned about Pakistan. They were not concerned about what they will achieve, but they were concerned about what's happening to Pakistan. Same school of thought as I come from. So that is how I joined Pakistan e-Insaf.
All right. I recently met a journalist, maybe you know him, Ali Haider. I was in Muscat and we were at a dinner together and he asked me something. And he said कि आप जैसे जो लोग हैं, meaning पढ़े लिखे लोग या successful लोग, whatever, आप लोग, you think you're above politics, right? So you don't get involved. And I said, all right, today I tell you, I want to get involved. I'm not above politics. I try to understand. I try to be involved, but I really seriously don't know how to get involved, And I didn't have an answer. And I said, चलो मुझे बताओ, मैं आज involve होना चाहती हूँ. I want to take responsibility for what's at my share of responsibility and what's happening in my country and do what I can for my country. So you tell me how I get involved. And we're supposed to follow up on that conversation because honestly, जब भी मैंने कोशिश की है, जब समझने की कोशिश की है, तो अनफॉर्चुनेटली मैं उस जनरेशन से हूँ जिसके पास सिर्फ पीटीवी होता था, सिर्फ पेरेंट्स होते थे और पाकिस्तान स्टडीज की किताब होती थी. सो मेरा बैकग्राउंड नॉलेज लिमिटेड है. मेरा जो जिंदगी गुजरी वो पॉलिटिक्स से इतनी दूर गुजरी, अपनी जिंदगी बनाने में, अपने मसाइल सुलझाने में गुजरी. एंड देन जब किसी से बात करती हूँ लोग गले पड़ जाते हैं बताने की बजाय. सो ऑनेस्टली इफ आई वांट टू गेट इन्वॉल्व, आई एम नॉट स्कैर्ड. Where do I even begin, right? So if I ask you the same question, I want to be more involved. मुझे डंडों से बहुत डर लगता है. What do I do?
वो कहते हैं जहां गुल हैं वहां खार भी हैं, जो दामन बचाएं चमन में ना आए. ठीक है? So what you need to do is that if you see politics, unfortunately the politics, when we describe politics, we describe people who are selfish, people who are illiterate,
yes,
people who lie, people who manipulate. That's not politics.
Agreed.
That's not politics that I try to practice. I'm above politics because, and I think you should say you're above, because you are not self-centered. What they mean by politics is that you are doing things for yourself to become an MNA, to become a minister, no. You do politics for the sake of helping people. Once you do that thing, you are above politics. You are above that thing. You are trying to give something back to the humanity, to the people, to the country, to your neighbors who are along with you. Now, if you are those blessed one who can donate time, because time is the most important commodity of your life.
Yes.
It's the most expensive commodity of your life. Money can come and go, but time once gone doesn't come back. So that comes most. So if you can donate time, please by all means join it. The concept is now where to join it. You have got different options. You can join any one of them. My simple concept of joining a political party was, okay, fine, I cannot join in principle a family dynasty. Whether good or bad, they could be good people, but that's not democratic value. So I cannot join that.
Mm-hmm.
So the only option I was left with at that time was either an MQM or Jamaat-e-Islami or Pakistan Tehreek-e-Insaf.
Which were not dynastic.
Right.
Yeah.
So MQM, their history was too violent. So I could not fit into that. Although most of them were from middle class like I was. Jamaat-e-Islami, somehow my experience with Jamiat when I was student was not very good.
They were very aggressive at the time, maybe?
Not aggressive. I mean, a lot of our people over there, they would misuse the concept of Islam.
At that time.
So, I just somehow could not. So, I was left with one choice, which is PTI. Not that I was not knowing Imran Khan, I was not a fan of Imran Khan. But when I joined it and when I was close to him, I realized he is not what people say about him.
Really? When you got to know him?
Yes. You see, I've traveled with him. I've worked with him. I've been close associate with him. I think he's one of the most humble man that I've seen. He is the biggest celebrity of the world. One of the biggest celebrity at the age of 18, 19, 20, he was living with the kings and queens.
That is true.
You remove the prime minister from all these president from all these president, their value as their person is zero. Less than what my value is.
Yeah.
Less than what your value is. Probably less than any people around us, their value is. They are as good as nothing. When I remove anything from him, Imran Khan is Imran Khan. He's a brand in himself. Look at what's happening in US. Donald Trump is using his conversation with Imran Khan sitting together, and that is being displayed in order to attract the votes. So that's a brand. That's a brand. So that is what it is. And plus, just imagine he is the chairman of a political party, and we were traveling for fundraising. And on the airport, he asked me, Dr. Saab, coffee peeni hai? And I said, yes, of course. And basically, he bought a coffee for me. He bought a croissant for me and for himself. And then we were sitting opposite to each other. And he was dipping his croissant and he was eating. Such a humble man. I've never seen. He doesn't wear any watches. He's a simple guy, the simplest of ever. His house is the most humble house that I've seen. It could be a big land. That's a different thing. But his house is a very simple house. Simpler than probably my house.
Yes. That part
So
of
that is
him
what
people need to know.
Yeah.
देखिए ना Dr. Hamayun, if I want to talk about, this is a line of conversation I would really love to pursue, because Imran Khan, the man, very few people know.
Very few people just imagine, I've heard a story. I've never confirmed it with him. I've heard the story. He had a flat somewhere in London, not the Kensington one, which he sold, but the other one. And that flat got fired. So somebody came in and said, Imran, तुम्हारा वो flat जल रहा है. उसने कहा चलो अच्छा है, जले उधर ऐसी पार्टी हुई है जो मैं सोचना भी नहीं चाहता. So you just imagine a man saying it is better that property is better to burn than. Just imagine you and me. I have made some property for my children.
और उधर आग लग जाए.
Imran Khan has donated every of his property towards a charity.
अच्छा, इसमें आपको एक स्टोरी शायद आपको ना पता हो. A journalist was sitting with him a long time ago in his office. So वो बात करने की कोशिश करते तो इमरान खान was very busy. This was told to me by a friend of the journalist. तो someone came in with a bag, right? उसने कहा कि ये क्या है? कहते जो आपकी प्रॉपर्टी, फैमिली प्रॉपर्टी की जो डिस्ट्रीब्यूशन हुई है उसमें ये आपका हिस्सा है और इसमें certain crore amount of money है. ले जाओ शौकत खानम में दे दो.
Exactly.
Right?
He has done everything like
did.
that. He's done everything like that. And Shaukat Khanam for whom? For you and me.
Huh.
Not for him.
Yes, yes.
You see, when people, seriously, when people say something will happen to, I said, I cannot believe Allah will leave him alone. Because thousands of people has prayed for him. Those young children whose mother have seen their children going through the cancer and then surviving because of Shaukat. At the end of the day, it is Allah. Zariya is Shaukat Khanam. And Shaukat Khanam was made by this man single-handedly. How can it be possible that Allah does not listen to him?
You see, when his mom was dying of cancer, I remember, because of family terms, I remember meeting her at that time. And even when she's dying, her only worry was Imran Khan, right? And how she would have loved to have seen him married before she passed away. That was one of the worries, and how scared he was of marriage and commitment. Typical mom ना. उस वक्त भी बाकी सब चीजें एक तरफ इमरान खान की शादी एक तरफ थी. But I remember the love, the fondness, the worry. I mean, she had other children, but he was the star of her eyes. And lo and behold, down the road, I hear about his journey of making Shaukat Khanam. And my friend, I met a couple of days ago, her husband is the lead general surgeon in Shaukat Khanam in Lahore. And she was telling me कि कितने patients, how many patients, children are diagnosed with cancers, advanced cancers. And you know, हमारे यहाँ advanced stage पे diagnose होता है because early hospital visit ही नहीं होता. Even ovarian cancer, breast cancer, हमारे mortality ज़्यादा because they are picked up late. Because we हमारे यहाँ cancer of cervix की mortality ज़्यादा because हम screening नहीं करते. तो वो ये कह रही कहती है यार, I'm amazed at the number of children that are brought to the hospital. कहाँ से लोग आते हैं. और हम दोनों परसों यही दुआ दे रहे थे कि अल्लाह भला करे इस बंदे का, जिसने एक जगह तो बनाई है जहाँ ये लोग माँ बाप लेके जा तो सकते हैं.
और आज नहीं बनाई.
Yes.
1986 में बनाया. 1990 is 2 something like that. उसमें वो किया.
It's inspirational. But see, this part, अब इन्हीं की journey देखें in politics. How tough has it been? How isolated he was in the beginning till people kept joining
him. Till 2011.
है ना, कितनी अकेली journey थी. So मेरे जैसा बंदा तो एक हल्का सा step, I mean, I'm not at all targeting something like that. But for me, practically venturing into politics is a scary prospect.
I'll tell you one thing. 2009-10, when we used to travel to Peshawar, trust me, sometimes there would not be a fifth person to sit in that car.
Yes, I've heard of those. वो इधर G9 वगैरह में जलसा करने की कोशिश करते थे, 4 लोग भी नहीं आते थे.
बहुत कम आते थे.
और वो जो 4 होते थे वो भी देख रहे होते थे कि उनकी करना है.
देखिए बात ये हो जाती है. Again, this is what I feel is determination. This is what you plan and then you have a belief in yourself. जो हो ज़ौक़े यकीन पैदा. When you start believing in yourself, then you can achieve anything in your life. And if you see history, if you read all those people who were successful, they believed in something
bigger than themselves,
bigger than them, and they believed in themselves that they can achieve it. You see, you will come across ups and downs in your life, but it's the faith in yourself. There is a famous Lao Tzu in 6th century BC. There was this person who actually said this quote, but I read it when I was going through the quotes of Hazrat Ali Radhiyallahu Ta'ala Anhu. And it says watch your thoughts, for your thoughts can become your words.
And the
Watch
words.
your words your words can become your actions, and your actions can become your habit can become your character, and finally watch your character, for your character can become your destiny. So in
Wow.
other words, if you change your thoughts, you can change your destiny. You can change your world. So that is how important that thought process is, and that is how strong that thought process is.
So, um, as a maybe conclusion to this part of our conversation, because I'm not going to let you go so soon, there are other aspects I want to talk about. So, for those of us like me who would love to do something, what do we do?
बेखतर कूद पड़ा आतिश नमरूद में इश्क, अकल है महवे तमाशा ए लबे माम अभी.
So, we just do whatever we can.
Just do whatever you believe in.
Right.
If you believe in something, you see, that movie Three Idiots, that tells you one message.
Yeah.
Message is, do what you believe in, not do what somebody else dream for you.
So if people believe in doing something, but they don't know a path, देखो आपका कह दिया कूद पड़ो भाई, किधर कूदना है, किस तरफ जाना है, क्या करना है, किसी को कोई डायरेक्शन, maybe a specific plan of action for a woman living next door who wants to practically do something and not get frustrated because this country is no longer fit for her children. What does she do? Where does she go?
You see, it's very simple. It's very simple. If I want to do something, for example, let's say I know you are a professional gynecologist and of a well repute, and you want to start this thing. You will ask somebody.
I'm asking.
Right. No. So that is how you do. So you start searching about it. You have a concept. Now you search the path to it.
Right.
It's just like, I have to come to your place. You send me a direction. I use Google Auntie and she directed me over here.
Across the road.
Across the road, right? No,
She didn't.
Over here.
Just,
exactly same, right? So now, you search, you ask people. At that time, you would ask people. These days, you search Google. You search the different parts of it. And then you talk to the people who are successful in that. Some people, out of jealousy, will not tell you the right thing. Some people, out of courtesy, will tell you, this is the easiest path. But then at the end of the day, you take a decision, right or wrong, you do it. Once you do it, you will have ups and downs. And that is when you keep on trotting that path, and sooner or later, as they say, even the longest day comes to an end. So you will see the light on the other side. It could be a tough journey, but the tougher the journey, the better the reward.
So, in the end, you're saying, if I want to, I have to go for it, find my path and stay focused and find my way, but do something.
Yes.
बैठे नहीं रहो, कोई नहीं आके ले हाथ पकड़ के नहीं ले जाएगा.
At the end of the day, again, hijrat karo. There is always a reward in hijrat.
हरकत में बरकत
है और पवित्र है शजर से उम्मीदें बाहर रख. So all these things, you see, at the end of the day, when we read them as a poetry only, fine. We see movies only, fine. But there is always a message in a movie.
Yes.
Try to find out a message in a movie. Try to find out a message in everything, and you will see that at the end of the day, there is a message. Just follow that thing. Your life will become, a book for the others to learn what to do or to learn what not to do.
Absolutely wonderful. I mean, this has been an unexpected insight into an aspect that I maybe wouldn't have talked about in such detail, but I was so fascinated by your thoughts. I just didn't want you to stop talking about it because I was thinking, okay, here I am. I'm going to find out what I'm supposed to do. But thank you for that. So, moving on, I would love to ask your opinion on two aspects of cosmetic and plastic surgery. Getting out of politics for a while. First of all, I'd like to ask you about people using plastic surgery as a shortcut for managing obesity. मैंने देखा है ओटी में बड़ी बड़ी स्लैब्स ऑफ स्किन एंड फैट पड़ी हुई देखी हैं, काट काट के उनको खातून को समेटा हुआ है. So is that okay to do that? Is that, I mean, What? Is there a limit? कितने किलो उतारते हैं उस पे? क्या करते हैं?
अच्छा देखिए इस तरह है, obesity cannot be treated by plastic surgery.
Thank you.
That's one.
That's
right?
my thought.
Now, because we misuse obesity as कि भाई मैंने वजन कम करना है, प्लास्टिक सर्जरी आपको तराशता है.
Yes.
ठीक है,
Yes.
वो आपको ट्रिम करता है in a certain areas. Let's say you have got a lot of love handles, so it will do a liposuction and give you that curve. If you've got an excess of skin, it will do tummy tuck, which you were referring to, कि इतनी skin निकाल लेता है. And tummy tuck can go with or without liposuction. So वो है. लेकिन अगर आप देखें कि बड़े से बड़ा tummy tuck और बड़े से बड़ा liposuction will only reduce your weight as in 4-5 kgs, not more than that. So it is not that. And then your weight is distributed throughout the body.
Yes.
Right? So the idea of doing a weight reduction and cosmetic surgery or having a shape is a combination of if you can't do weight reduction because obesity by itself is a disease, so you need to treat that disease. If you do not have the willpower to change your lifestyle and dietary habits, then you go to somebody to help you. It could be a non-surgical way of reducing your weight, or it could be surgical way of reducing your weight.
All right. So you are coming to the point of using surgery for weight reduction.
Yes, but that is a different thing. That's called gastric sleeving. That's called gastric bypass. It's those things. So what you do is you either reduce the size of your tummy, or you bypass the stomach and send everything to the intestine so that it's not absorbed and you do not get those calories.
So first step is lose the weight.
Yes.
You can't use plastic surgery
No.
I saw
not
40-50 kg of stuff
it's
taken
not.
out
40-50 kg
from the back, the belly, the arms.
You will never have 40-50 kgs of that because there's a lot of fat, lot of weight behind the muscle, which we called as visceral fat. You will have a lot of weight around thighs. If you remember, when we were reading initially, a centimeter of increase in the girth of your thigh can accommodate almost about 1 liter of blood fluid. So similarly, fat volume 1 centimeter of that. Now people are fat by inches. So just imagine how much fat that could be. And if you remove all this fat, you are basically anything more than 20% of the body surface area. If you do liposuction, patient is a great danger of losing its life.
देखिए यही तो बात है, body is in a fine balance. So my patients, correct me if I'm wrong, when they come with asking me कि मैं ये करा लूँ वो करा लूँ, मैं कहती हूँ पहला काम work on your weight loss, right? अगर weight loss again करना है और you can't focus, get counseling, get a nutritionist, get a trainer. नहीं कर सकती, then gastric banding and all those to lose the weight. Once you've lost the weight, then go to the plastic surgeon to fix all those loose skin and those pouches and those love handles and everything. So I'm giving the right advice?
Yes, you are giving the right advice. Now there are two things. You see, this cup is bigger than that cup. This cup needs weight reduction first and then trimming.
I will never look at the cup the same way again.
Now, your cup is just slightly bit bigger than the normal. So it might need a little bit trimming and then an incentive to improve that thing. So those people who are on the boundary line of not being obese, but being slightly bit bulkier, they might need a little touch up initially, safely, and then that can give them an incentive
to do better.
So but there is a clear cut line where you can do. Over here, this is where you need to go and talk to a doctor who does not believe in making making money is not bad, but giving you a wrong advice and making money, as far as I'm concerned, is also haram.
Yes, अमानत होती है, मशवरा अमानत है.
Exactly.
And as consultants,
it's our responsibility. So that is why you go to the right people. There are a lot of people who come to me, they get an advice from me, but they don't get operated by me for the simple reason, I think, I'm this, so I charge a little bit more for my time. So then they go to other good surgeons.
I often send
Yeah,
people
so
to other
that's-
good surgeons
yes, so
when
that's-
I feel that they can't,
Yes. So that is how it is. But it is my responsibility to at least guide them properly.
So we agree.
Yes.
First the weight loss.
First the weight loss.
Then the plastic surgery.
Yes.
You cannot use plastic surgery and remove
No.
huge slabs of meat
No.
and think that is
No.
okay.
Even what we call as mummy makeover. These are not fat mummies.
These
are mummies who, not mummies as in,
the
Egyptian mummies,
yeah.
but these are mummies who have got loose skin, who have lost the shape of their body, and that is bothering them. So that is the ones where you do 2 or 3 surgeries combined together as a team, and within a period of, let's say, 6, 7, 8 hours, which is all those things, keeping her safety this, and then you change all those things with plastic surgery.
Done. So this was the thing that I really, really wanted to address,
Yeah.
because I am tired of people being lazy and using shortcut of plastic
No
surgery.
shortcuts.
And I'm also tired of the surgeons who agreed to do this. I'm
I
sorry,
totally agree.
but I've really strong feelings about that. Now, one more question. One more question. Now, and another change. Plastic surgery. The whole, the facelift. I'm not talking about cosmetic surgery and facelift, because there's so many other things before that, and you don't even do them much yourself. You're such a great cosmetic surgeon. आप तो वो final वाला करते हैं ना. So, is there an age before? Is there age? Age is a factor where you would say कि okay, इस age से पहले मैं cosmetic surgery नहीं करूँगा, unless कोई deformity वो अलग बात है. But just to look better and younger, what is the minimum age at which you would do a plastic surgery, cosmetic surgery?
You see, cosmetic surgery doesn't have to do with age. There are some young people who have got eye bags. Some very young people. It's a hereditary situation.
That's
right?
a problem. No?
There is the young people with a crooked nose.
वो तो आ गया.
All those things.
हाँ,
But that's
जिनका-
also cosmetic surgery.
ठीक है, वो
Right?
तो हाँ.
So there is no age limit in terms of, let's say for a nose less than 18, you don't do it because you are still growing, and if you do something, it can change something. So that is something we do not know yet. Is it a myth or reality?
But you are not willing to risk it.
The age. But generally concept is not less than 18. Now, coming to facelifts that we all do, and I do a lot of them. Facelift, or let's put it like this, any cosmetic procedure has to do with this thing. Which how you see yourself in the mirror. For example, if I have a liver disease, the sign and symptoms would be A, B, C, D, jaundice, and this and that and everything. For a cosmetic surgery, the symptoms are you do not like
the way
what
you look.
see in the mirror, and that is affecting your self-esteem, and that is affecting your confidence. So if you are among those people who is because of how you see yourself, or because whether your face is sagging or not sagging, but it is bothering you, keeping in mind that there is a disease or there is a condition called body dysmorphic syndrome. So if you are excluded from that, and there is a genuine reason for you to not like something on your face, body or something, and it is bothering you, that is, in my opinion, that is the only indication for cosmetic surgery. It is not, going for as a kind of changing clothes, getting new shoes. No, it's not.
It
like
shouldn't
that.
be as simple as that.
It's not as simple as that.
So your advice is, a person decides. There are people who can age and still love the way they're aging, love their lines, love whatever is happening to their face, and get nothing done. And
Yes.
that's fine.
Yes.
And those who want to get something done, that's also fine, no judging. But I think बहुत young age में अगर कोई approach करता है तो again, as it's the surgeon's responsibility.
Most of the people at young age do not need it. Let's put it like this.
हाँ,
right?
तो फिर surgeons agree ना करें ना. It's another thing ना, कि आप नहीं agree करो उस cosmetic surgery को जो उसके लिए
exactly.
सही
नहीं, वो
नहीं
नहीं
है.
कहते. That's I totally 100% agree with you over here. But at the end of the day, again, as I said, it's how you see yourself. If it's bothering you a lot.
But if it is bothering you a lot, पहले जरा psychological assessment तो होनी ही चाहिए ना.
Yes.
It's not just मेरे
there
पास
are a lot of-
vaginoplasty के लिए आते हैं and I tell them it's not going to fix your marriage.
Yeah, okay. That's exactly. There are people who come to me, the parents, and say that, look, our son or daughter, most of the time, daughter, can you do this surgery for her? And I asked the daughter, how young are you? And she says 19, 20, whatever, or 18 or 17. I said, okay, fair. Does it bother you? She said, no. And I said, no, sorry, I'm not going to do surgery for you. Because at the end of the day, as a mother, I would like to, or as a father, I would like to do something for my child. But if he or she is not conscious of it,
Be conscious.
so why to do it? Because at the end of the day, it is his or her life that they need to take a decision on. So once I tell them, the day they become conscious of, that day, whether you agree or not, and if she or he can pay me the price, I'll do it for them.
Agreed.
Because that's what it is. So my concept is that it has to affect your lifestyle or life in general.
Quality of life.
Quality of life. Because if you start becoming too conscious of it, you can become an introvert person. You stop meeting people. You might not be. There is a study. It was done in NHS because NHS would not allow cosmetic surgery. So those people who wanted cosmetic surgery
and
before and after cosmetic surgery, they started to have so much good feeling. They became a better taxpayer than before. So in other words, the NHS was spending X amount of them and they return Y amount in terms of back to the community. It paid more. So from the point of view of that thing, you start looking good. You know, the moment you are going out, you see this mirror and, you know, some lovely person is there, you know, with bright eyes, all these things. You feel good. The world is good. Everything becomes positive. Your attitude towards life becomes positive. You start forgiving and forgetting certain things in your life and you move on forward. So that positivity comes with mirror
on the
wall.
Last question. We have fantastic plastic surgeons, cosmetic surgeons, as example. Why do people go to Turkey? Is it a fashion?
Two things. Some surgeons, you see, Turkey as opposed to the Europe and US is much cheaper.
Fine.
Right? Some surgeons in Turkey are really good.
We have better. I have yet to find out of surgeon there just as other skill.
Fair enough. Plus, at the end of the day, dur ke dhol suhane bhi.
Yes.
And plus, the biggest problem in Pakistan is post-surgical care. That depends on our nursing as an institution, which is...
You think that's a serious...
That's a serious... All my international patients who come to Pakistan and get their surgery done, they complained about nursing, the ethics, the simple work conditions. You know, the nurses they're not tuned for asepsis in Pakistan. They're not tuned for doing things the right way. Somehow Pakistanis in general are not tuned to do things in the right way. I'm not saying everyone.
Yes, but as a nation, we are so used to shortcuts and just barely getting by. We'll do the minimum necessary.
There are 13,000 nurses who never attended a nursing school but yet got the
nursing degree and registration.
There are so many nursing schools which are not affiliated by any hospital and they become nurses.
And yet these nurses are registered with the nursing council?
Yes, they are.
So how does one how does one so doctors ka hota hai PMDC mein registration, we are registered there. That's how people find out that okay, we are good to go, we are doctors, we are at registers. So nurses be, they are registered with the nursing council, and that's how we allow them to work in our hospitals. So actually they could be registered without ever having been to a nursing school.
No, some of them, yes. Some of them, the nursing school are not
Up to the mark.
associated with a hospital where they will get hands-on training, just like doctors do. Even initially, the medical colleges were not, there was no restriction on them to have 200 bedded hospital. You are making a teaching institution, but you do not have that. So their students will come out and
not
they
having
will not
seen
have
a patient,
not having
ever.
seen or not having seen enough patients. That would mean so these days with 500 bedded, yes, they need to do that thing. So all those things are there. I think there is a, since I've become a senator, I feel sorry for this country. Because the people sitting out there are not honest to this country.
Do we have hope?
Yes. The hope is you change yourself. As Allah says, jaise tum waise tumhare leader.
So we have to do better.
We have to improve our thought process. Then we will start seeing the problem in them. We as a nation, as you said, shortcuts. And I'll tell you one thing. If it's true for my son, I'll talk to someone. Isko job de do. Without realizing, I'm going to take away that job from someone who deserves. Yeah. That means a person with a lesser intellectual than the person deserves comes and sit on that position. That means his mental capacity cannot fulfill the criteria for that job. That means all the decisions made over there will not be good. That is how this Pakistan has deteriorated over the period of last 40-45 years.
I wonder, all right, we have the fabulous leader XYZ, ABC, anyone who comes along and sits there. How in the world does he start fixing this country? Everything is so wrong.
It's
everywhere.
Not easy. It's not easy.
It's not easy,
it's
but
not
there
easy.
would be, I hope, a method to fix things. I mean, this is my hope and wish and prayer.
It goes through the hard way.
Very hard.
Very hard. We as a nation must have to go through that hard path. That is the only way. We have to change ourselves. Every one of us is stealing money by not paying our, you see, all these indirect taxes that we say, oh, tax to hai na. But they are indirect taxes, which is for me, you and the person who is working on the street, everybody pays the same percentage of indirect tax.
Exactly.
But if I start paying my percentage of direct taxes, I'm going to reduce his burden.
This is the problem. This is why inflation is increasing, because of all the indirect taxation.
Wrong decisions, wrong policies, because of wrong people sitting in the right places and taking the wrong decisions because they do not have the mental capacity. Our decisions are not based on evidence based. Recently, these, changing the number of, making a parallel code, changing the number of judges is not going to fix unless you do not know what is the underlying cause. When you say about case weightage, find out what does that mean. 99% of the lawyers and these 100% of the lawmakers do not know what a case load is.
देखिए ना डॉक्टर भाई, हमारे अगर इसको एनालॉजी दें, जैसे हम अगर डिजीज के कॉज को नहीं ट्रीट करेंगे तो हम डिजीज के सिम्टम्स जितने मर्जी
कर लेना, आप सिम्टम्स कर लिया, मेरे सर में दर्द है, वो सिंपल मेरी नजर की कमजोरी से भी हो सकता है. जब तक आप मुझे ऐनक नहीं देंगी, मेरे सर में दर्द होता रहेगा, चाहे
मैं आपको एंटीबायोटिक का
जो मर्जी करा लूं. Just imagine one minister is saying that in the last 8 months I've had 7 times antibiotic course because of the air pollution, and people thumping their dress for text for that. Just imagine how. That's what I'm saying. Since I've become a senator, I sincerely doubt that this country, what I've seen inside and how it is happening and why it is happening, I sincerely doubt that the people in the helms of affair
Can fix anything.
No, are in a mood to fix it.
Oh, so capability comes later. It's the intention.
It's their intentions ही नहीं है because they benefit from this system.
Oh wow. And here I was thinking, अच्छा फिर भी कोई उम्मीद की किरण आप दे रहे हो ना?
There is always
आपने कहा कि हमने खुद ही करना है. That's where the hope is. हमने खुद ही करना है.
चबड़ के खुद उठा ले हाथ में मीना उसी का है.
बस ठीक है. मैं अपनी हेलमेट करनी है.
हाँ. नहीं डरना तो नहीं है ना. डरना
नहीं तो हेलमेट
खौफ का बुत तोड़ के निकलना है.
हेलमेट पहन के.
हाँ वो अल्लाह ताला कहता है मुझ पे तवक्कल करो लेकिन पहले ऊंट का पाँव बांध दो ना. तो हेलमेट पहन के.
It's been so wonderful, Dr. Humayun. It's been really, as a friend, तो बहुत मजा आया अरसे बाद आपसे गप लगा के. But really, it's amazing. This conversation went from one thing to another to
It's
another.
just like friends, talking after a long time.
Yes, with friends. It's just as if you just missed yesterday.
Yes.
Every time you sit together, लगता है अभी कल ही मिले थे. So basically, we talked about everything, and I'm so happy you came. And I'm going to hold you to the promise that you will come and sit with me again, inshallah, someday when you have more time. But thank you so very much. And guys, we talked about so much stuff. It has been one of the most interesting tea talks I have done. And hopefully we will be seeing Dr. Humayun with us again. Thank you. And please ask your questions in the comments below. And inshallah, see you again very soon.
Dear friends, don't forget to like and subscribe the channel. And please don't forget to press that icon bell. Thank you.
Thank you. Very